Good morning and thank you for joining very early in the day today. It's a Sunday and it's one day before the Women's Day. The reason we have a webinar around Women's Day is that Women's Day is all about actually celebrating and highlighting issues around women's health. And the word Atmanirbhar, for a lot of people who don't speak Hindi, means self-reliant. A lot of conversation is going around in India about Atmanirbhar Bharat, which means how do we make people more self-reliant, more entrepreneurial. And when we look at entrepreneurship, we wanted to highlight the role of women's health businesses in entrepreneurship. How by setting up sanitary napkin manufacturing units, how by creating a distribution network for distribution of sanitary napkins, you can actually employ many more people in your community and actually make the community self-reliant. And that is the aim of the webinar today. Also, over 5.5 years since Saral Designs has been operational, we have had the opportunity to meet stellar people in our network who have created some of these self-reliant businesses in their communities and actually created immense impact also in terms of menstrual hygiene awareness and access to products. This is something that we wanted to highlight today. So we have a amazing group of people who would be joining us today over time, just to take you through what the flow of the webinar is going to be. So we have just started, we have welcomed each other, and I'm really glad to see the diversity of participants that we have today. We'll start with a panel discussion on social entrepreneurship. The guests on the panel have actually joined us already. I'll quickly jump into introducing them shortly. After which we have a discussion on industry trends and innovations, where the industry is going, what should we look forward to, what are the material innovations, product innovations which are happening in the feminine hygiene space broadly. And lastly, we have a session on innovative financing for setting up your manufacturing businesses. The last session is slightly more specific to Indian context, Indian banking, subsidies, etc. But it may be of benefit to people in other countries also to look at what are the different types of financing that could be available, from debt to grants to actually looking at peer financing and a lot more. Lastly, at the end of the session, we have kept about 1 hour where the Saral Designs team will be available with you. We'll divide ourselves into 3 or 4 breakout rooms for international participants, for domestic participants, for non-profits and for-profits separately, so that you can actually ask your questions related to setting up your financing business. That doesn't mean that you can't ask questions in between. Just for ease of conducting this workshop, we have automatically put everyone on mute, but you can always ask your questions on the chat box. So with that, let me get to our first panel discussion. I'm really excited about this, which is on social entrepreneurship. Saral designs ourselves, we call ourselves social entrepreneurs, and with the work that we do, we create many more social entrepreneurs. So today we have a fantastic set of panelists. I'm really inspired by these 2 women myself. So let me start with Melissa. Melissa is joining us from Los Angeles. She, in fact, is the producer of the movie Period, End of Sentence, the documentary that actually won an Oscar prize. She is also the founder of the PAD Project, which is a non-profit organization that is working towards increasing access to sanitary napkins, like in the movie. And she has won various awards, and we are really happy to have her here. With her, we also have Ajita, who writes extensively on women's health. She's a deputy editor of Business Today Group, and she's been a journalist, a reputed journalist for about 25 years. She also does a lot of volunteer work and is passionate about social businesses. So welcome, both of you. Very happy to have you here.
Thank you.
So I'll quickly jump into the questions without taking a lot of your time. So Melissa, I think everyone has this question that what made you make a documentary in India about menstrual hygiene, and what were your key insights or learnings from there?
So first of all, thank you so much for having me here. I'm delighted to be here. And I just want to say to everyone who is from India or from South Africa, forgive my pronunciations where I pronounce things incorrectly. because I am from Los Angeles, California in the United States. And also, I could probably learn a lot from all of you who are studying entrepreneurship. I'm, in fact, an English teacher in Los Angeles, and the story of how, why I decided to mobilize my high school students to try to raise funds to make a movie in India is an interesting one and a strange one. So I was part of an organization called Girls Learn International. Girls Learn International is an organization that seeks to give high school students a voice in the growing movement to support equal access to education for all genders. As part of that organization, I traveled to the United Nations with my students 5 years, 7 years ago to the day, to today on Women's Day for their conference. And we learned about this issue of girls dropping out of school due to lack of access to a safe means to manage their periods. I felt very ashamed about my own ignorance. I felt very sad that this was happening around the world, in the United States as well as many other countries around the world. It is estimated that 1 in 5 girls misses school because she doesn't have an adequate means to manage her period. So maybe being from Los Angeles had something to do with it, close to Hollywood, but we all decided somehow we were going to make a film to shed light on this important issue. It took a lot of time, and it's a long story. It was probably 6 years between this idea to make this film and the film starting to go to film festivals. We had a lot of luck and a lot of good connections on the way. The first being, I started talking about this organization called Girls Learn International. Girls Learn International is an organization based in the United States, but their first international partner is Action India. Action India is the NGO that helped us to identify the village in Katikera where we set up the pad machine and where we went to film the documentary. So that's kind of a long answer, but Suhani, I hope that answers for you.
Absolutely. I think most of our journeys are very similar when it comes to not knowing about menstrual hygiene and how ashamed we feel that it's been so long and we didn't know about this. So because there's so much taboo, and that's why, documentaries like Period of End of Sentence and the movies that are being made in India and all the campaigns that are going on are so important. So let me actually move to Ajita. You write extensively about women's businesses, social businesses. What inspires you to, make this your area of focus and write more about it?
To be honest, my first story on a startup which works in the menstrual hygiene space was actually Saral Designs. So, that's how that was my very first story. I think this was way back in 2017. And also even prior to that, I write a lot on rural consumption, which takes me to rural India pretty extensively. And, typically I would go there to report for a business story, but I love talking to people and understanding their culture. And I was really shocked when I traveled to some villages in Gujarat, Maharashtra, Jharkhand and all those states wherein I got to know that there were a lot of dropouts, school dropouts among girls, and 90% of the reason why they were not able to go to school was, period related problems. And, they would, and in most of these remote villages, they wouldn't have a school in the village and they had to travel a distance. Many of the girls had to cycle a distance to get to the nearest school. And obviously when they started having their menstrual cycle, they would, it was getting too difficult for them and they just decided to drop out. So, and after that I met you and we did that story. So my interest in the subject kind of started from there. But having said that, I write on diverse topics. It's not necessarily on menstrual health, but I write on a lot of other, socially relevant issues. And in Business Today, we have a property called the Business Today's most powerful women in Indian business, and wherein we kind of honor corporate leaders. And we also, then after that, we thought we should look at, we should have a category wherein we could honor women leaders who made a difference to the society. And that is when that is when I really started writing very extensively on women related topics and women related social enterprises. So so as we go along, I'll have quite a few stories to tell you, so we shall discuss about it.
I'm looking forward to hearing some of those stories from you. I've
Yes,
heard
yes.
them personally, and I will be so happy to, for everyone to learn about all the inspiring journeys. So coming back to Melissa, I think, so I just wanted to hear, when you were filming the documentary, what were some of the things that you didn't know that you knew, and what inspired you to actually work on the PAD project and support social entrepreneurs? So tell us a little bit more about your journey from there.
So this is, I don't know, this is a little bit of two stories. One, how do you make a film? And two, how do you start a nonprofit organization? And we actually created the PAD project as a way to raise the funds to both make the documentary and to secure the pad machine that we would then send to the partner community that we were working with in Uttar Pradesh, in Katikera. So we fundraised. We started a Kickstarter campaign. The students did. You can still, I think, find that on Kickstarter. And we raised enough money, 60,000 US dollars, which was incredible. This was high school students. We started with bake sales. It was quite an entrepreneurship effort. We hired a young director, Raika Zatopshi, who really took on the making of the documentary basically for the price of the ticket to New Delhi. And she filmed the film in two parts. First, when the machine arrived, because we wanted to capture the knowledge about menstrual health and some of the stigma around it before the machine. And then she came back 6 months later to see what difference the machine may have made in the community. And it is a documentary, and we did not know what we would find or discover. And I came to Katikera to visit the women and to visit Action India, our partner organization, about 3 months after that, to screen the film for the first time for the women. I don't know how many of you have seen the documentary, but for the women in the film, which was a really incredible experience. And I feel like I answered one part of your question, and I feel like you had a second part that I'm now kind of blanking on and talking. So you can ask me again or ask me later.
So more on the PAD project now, I think it's been one thing that I think is interesting for everyone to learn, that there are so many different forms of financing. We typically look at bank loans, or as nonprofits, we look at going through CSRs. But probably one of the most spectacular things that came out of the documentary was actually the whole fundraising campaign and the awareness it drew towards the cause, which has actually helped you scale up the project beyond the village in Uttar Pradesh. So why don't you tell us a little bit more about the PAD project and what it has been doing since?
That's correct. So the PAD project sort of tagline is: a period should end a sentence, not a girl's education. That was what I said at the Oscars. And because of the Academy Award ceremony having such a global audience, it was incredible to have that platform just to say those words. And we had no idea how intensely that message would resonate. So when I woke up the next morning, or that night, but I didn't look at my computer that night, I literally could not receive any email because emails were coming like a hailstorm or a snowstorm, one after the other, and I couldn't open one before I was getting another. Where can I get a pad machine? How can I do this? I want this for my community. This is what's happening to me when I get my period. This is the access that I have. This is what I don't have. And I realized, and donations, small, really small donations, which, from all over the world, so touching, but so many of them from people wanting to lend to this cause and wanting to get behind it. And one interesting thing with today's message is, for those of you in the menstrual care space, there are a lot of different ways you can contribute to a woman having adequate means to manage her period. What we have found, though, at the PAD project, and I'm sure Suhani really knows this with Saral Designs, is that what most communities who reach out to us want is the means of making, producing, naming, marketing, distributing their own pads, because that is what gives agency. And I can't pronounce the name of this, what this thing is called.
Atmanirbhar, yes.
Thank you. And I think that is what we learned from the documentary, that it wasn't just about having a safe way to manage your period. It was about the sense of self-reliance that comes from being able to earn a little bit of money, being able to make your own product, being able to contribute to your family's, mutual earnings. So all of that really was a beautiful and sort of humbling realization.
That's beautiful. I think, that's a learning for everyone in terms of how do you engage your community. And if you're able to inspire them, there's a lot more support that you'll get, not just monetary, but also in terms of in-kind support that we have also seen in many stories that we hear. So moving from actually looking at menstrual health businesses, we also wanted to, get Ajita's opinion and on what other social businesses are something that you found very interesting. And as a business journalist, I think some of these insights would help our entrepreneurs to look at more innovative business models for themselves. So could you share some of the interesting stories that you came across?
Yeah. So let me first talk about something in the healthcare space itself, which really, really fascinated me, and I can't stop talking about it. So, we traveled to a place called Gadchiroli. This is in Maharashtra. It's closer to Nagpur, and it's a Naxal infested area. So, people generally ask, when we had to interview this doctor called, her name is Dr. Rani Bang. She's a Padma Shri Award winner, and she's a gynecologist, and her husband is a physician. And both of them had very lucrative jobs back in the US. And then, they just suddenly decided to give up everything. This was almost 30 years ago, and come back to India and give back to the society. So they set up this hospital right in Naxalite infested area, which where people would never like to go. I mean, people are scared of going to those places. They set up hospital there. They began with, that time, 30 years ago, malaria was the biggest problem there, and people were losing their lives to malaria. So, they kind of built an awareness. They created a system wherein, people could battle malaria. So, and there, instead of, and people had, it was a society which was very closed, tribal society. People believed in quacks and, all those jhad fook. So what they did is, instead of alienating that community, they empowered them. And, they taught them, they told them how they could tackle malaria very scientifically. So it began with that. And then after that, they moved to women and infant care, that is, prenatal and postnatal care, wherein they have trained, they have trained midwives, the traditional dais, the birth givers in a village. They trained them to scientifically conduct deliveries. So suppose, a woman gets into labor and it's not possible for, and it's too late in the day, those the caregiver there, the birth giver there, has been trained to scientifically conduct a delivery. And the way she was, and I met this lady called Kajubai, and I'm just like, I can't, I mean, I'm full of admiration of her. So Kajubai is around close to 70 years old now, and she has no formal education, so she's a birth giver. So she's been trained, and now she runs a small dispensary kind of a thing in her veranda. She squats on the floor, and that dispensary has a blood pressure machine. She wears a stethoscope, and and she has got basic medicines. So if a patient goes there, she gives the basic care and then immediately rushes the patient to the nearby hospital, which is Dr. Bang's hospital. And Dr. Bang has trained many such Kajubais, and they are all self-reliant now, self-sufficient. They have their own living, and none of these people have any formal education, and that really, really inspired me as to how they were, kind of how they have empowered rural women, who. And Kajubai lost her husband when she was very young, and you know how it is in our societies. If a woman loses her husband when she's young, and when she's young, she's looked down upon. And how she's managed to create respect for herself, and Kajubai is a messiah in that village, and I found that very, very inspiring. So that was one of them. You want to move to your next question, or should I continue?
I think this is amazing what you talked about, and through the work of Saral Designs and our entrepreneurs who set up these manufacturing units, we have also come across such amazing stories. Many a times a lot of people, investors, come and ask us, how would people in like a tier 4 town be able to sell without any official proper sales training? They don't have MBAs, etc. And so many highly educated people find it very difficult to sell sanitary napkins. It's a difficult category. So I also remember a conversation like this. There was a woman who said that I have moved from streets to actually having a pakka house of my own. So these are only like 500 packs of sanitary napkins that I have to sell. Of course, I can find a way to sell that. So I think it takes a lot of determination and courage, which we undermine a lot, ourselves in our minds, whether people can do it or not. And with such stories, I'm sure, these models are built on various such stories of courage. I also wanted to hear from you, Ajita, in terms of the stories of distribution models that we were talking about. A few that stood out for you. Those would also be like fairly interesting for our panel.
So I'm sure everyone would be aware of Unilever's Shakti Amma project, wherein they empower women to do last mile distribution, but they typically distribute the HUL products. So I recently did a story on a company called Frontier Markets. So they also have a similar model wherein they empower rural women to do last mile delivery. And this is not of FMCG products, but white goods. So it could be a television, it could be a refrigerator. They have something called Sahelis. They have a concept called Sahelis, just as you have Sanginis. They have a concept called Sahelis. So they work with some 10,000 odd Sahelis now. And so what was interesting was when Frontier Markets, started business, it was an all men distribution network. And they soon realized that when you go and sell in a rural market, the men are often not allowed to enter people's homes because there are women there. So they don't want to a stranger man to enter their house. So she thought, if a woman enters, it's much easier for a woman to enter people's homes because the buying decision is typically made by the lady of the house. So it'll be easy for her to kind of to play the role of an influencer and motivate these women to buy products. So this is exactly what she did. She, these Sahelis go visit people and they get into a conversation with the women in the house, and she makes a saheli. If I mean, what she told me was what the founder of Frontier Markets, Ajita, told me is typically a saheli, on an average makes sales of worth to the tune of 65,000 every year, which is quite a bit in a rural market. And this is all, she goes into people's homes, chats with them, and tries to understand what their needs are, and she solves for it. So yeah, that is something kind of which really appealed to me. And again, they are so, in fact, we all talk about since I write a lot on corporate India, we talk about women breaking the glass ceiling in corporate India, but actually I find in fact a lot of women in the rural areas have done far better things, and they have actually broken the barriers of patriarchy, and they are there where they are. And some of them do such interesting things. In a village in and around Nashik, probably I've met a woman, who was selling fish masala. Okay, so it was like she was selling it for 1 rupee or 1 rupee, and it was packed in a newspaper. And I said, I mean, what kind of money do you, why are you selling fish masala in such small packs? So she said, no, nobody buys bigger packs here, and people want, people, when they go to the fields and on their way back, if they want to cook fish, they just buy the small packets for me. And they don't have that much money to spend, so 1 rupee 50 paisa or 2 rupees is a good price point. So they buy, and they make the fish curry out of the fish masala. And I keep doing multiple stories on ready to eat, ready to food category, how people are getting into coming up with solutions. It's become such a big market in India now, but I saw it in a very humble way in a village in I don't even remember the name of the village, but it was somewhere close to Nashik. So there are far more interesting stories in the smaller markets, and the Bharat story truly is playing up in a big way.
I think these are such amazing management lessons for everyone. I think all these concepts get taught in management schools about how do you have smaller pack sizes so that
Yes.
the consumers who can't purchase in bulk can do that. And it took a while for multinational companies to come up with the sachet packs, and this is
Yes.
something that you automatically see as a natural knowledge existing in many
Yes.
places. So that's beautiful. Some of these stories are beautiful. And even in terms of the distribution model with frontier markets and HUL, I think that's something that a lot of our entrepreneurs are also trying to do, and create a local distribution network. And especially with, I think with women's health and hygiene space, what we have also seen, there's a lot of shyness and barrier in many new adopters of the product. So if there's a women only distribution network, there's a conversation that happens. So we say that our Sangeetis are not just like saleswomen who are selling sanitary napkins, they are actually the champions of menstrual health in the communities. And a very important part, apart from training about sales, is training about menstrual health, because a lot of these questions get directed to them. What should I do? Probably you know more. So I think the reason a lot of them stay as a part of the program is not just the earnings that they have from sales, but also the pride that they feel that they are a part of a community and they're improving
Yeah.
women's health in general. So thank you for sharing these beautiful stories. I'm sure people have a lot to learn from this. Thank you. So I think I'll move to Melissa and back to more in terms of menstrual hygiene businesses. And let's talk a little bit more about the collaborative projects that Saral Designs and the Pattern project have worked on. There are quite a few, but I'll let you speak. And more in terms of, I think for everyone, the exciting thing to see would be, of course, the range of the number of projects that we have worked in Asia. But at the same time, how do you shortlist that this is the nonprofit that you want to fund and support? So that people can learn what skills, whether they have it right now, what can they build so that they can be a part of similar network.
Thank you. And just quickly, just to pick up on what Ajita was saying, and you were saying about the smaller units sometimes being better to sell. One of the reasons that the pads from the machine are so attractive to so many communities is because if a woman can't afford, say, a whole package, or she has a day that is heavier, she may just buy one or two. And that's more affordable than, say, going to a store where you need to buy, you know, a packet of so many. And if women have control over the machine and how many they produce, you can personalize it that way. But to broaden out and say, we are so excited that when we got all this demand that I was talking about, we quickly learned about Saral Designs being the leader in this space, because the machine that you see in the documentary, by the time the documentary came out, it was outdated. It was already 7 years old. And by now it's 8 years old. And so not working. And so we have been thrilled. So the different places that we have partnered with Saral Designs are in that original community in Katikera in Uttar Pradesh. We are putting a machine there, which we're very excited about with our original NGO partner, Action India. Then we are in Sri Lanka with an organization called the ARCA Initiative. This is an NGO that works with women and young people on issues pertaining to sexual and reproductive health. This is our first pad machine in Sri Lanka. We're also working with the Desai Foundation in Maharashtra, which I know has worked with Saral Designs, and their mission is to empower women and children through community programs to elevate health and livelihood in India and the US. I'm reading their mission statement so I get it right. Also, we have a pad machine on the way to Rajasthan. And I know I'll pronounce this badly. We call it KSCF, Kalya Satyarthi Children's Foundation. And they work to eradicate child labor and child exploitation. And so a pad machine there is something that's really going to provide agency and a place for their community. And then really remarkably, we placed the first pad machine in Afghanistan at a women's collective hospital, a maternity hospital in Kabul. So we're very proud of partnering with Saral Designs on that. And it's been exciting. So we're hoping a lot of different communities want the pad machine. So it's a matter of how can we get one of the machines to places that are farther and farther away, because we have requests from East Africa, West Africa, South Africa. I know some people on this call are South Africa. So like, how do we get this machine to more communities?
I think it's fantastic. Firstly, all of these nonprofits that the PAD project is supporting have done stellar work in their individual areas of focus, and I think that's something that stands out in general. So one of the things that we also recommend entrepreneurs and nonprofits is that, of course, in this entire space of setting up a manufacturing unit, it's a full-fledged entrepreneurship opportunity that you are taking care of, right from actually understanding sourcing to running the business to actually doing distribution, awareness, etc. So it generally helps if you have some network in the community already. So most of these organizations, of course, have a fairly strong community experience in different fields, and they are actually building on top of that. So that's something which is beautiful. Melissa, do you want to share any advice that you would have for people who would be approaching you, who still approach you for the pad machine? So what do you look at in general, or is there any criteria that you have in mind, or you're slightly more open in seeing who applies?
So there is, we want to work, as you said, with an NGO or a community that already has maybe engaged in menstrual health and education workshops. The PAD project works a little differently in the sense that we don't feel we know what's going to be best for any individual community, because we do work in so many different communities. So it's important to understand that there's support within the community, and that there's that self-reliance that we keep talking about, that there is a program manager We've met so many wonderful men in this space too, who are willing to step up and lead programs. And of course, women who, what an opportunity for them to work usually on different machines. There are so many different aspects, but you could imagine that it would take a team of, say, 6 women, maybe more, working on the machine, depending on what kind of machine. But then who are going to be the women that are going to figure out the business model? Who are going to be the women who distribute? Who are going to be the ones who market it? So there are all aspects of it which becomes creative and empowering. And also, just to take on another point, I think why I guess I originally got into this movement for menstrual equity is because there is so much shame around the world around what is really a natural biological process. And what we noticed with period end of sentence, and what we keep learning and learning again, is that when there is a kind of business around it, and something that's sort of visible in the community, that shame and stigma sort of goes away, and it becomes, you know, a kind of source of pride for people, which is really, that's the, you know, that's the goal. But we look for communities that are already engaged in this work, good lines, strong lines of communication, and follow through. And this is really a new field. This is, you know, people ask what studies have been done. Well, we're new. We're on this road now. So, you know, it's up to all of us to kind of figure out how it can work.
And I completely agree with you on that in terms of the amount of research which is there on menstrual health is very, very limited. And whenever, at least, 6 years ago, when we would go for asking for funds or something like that in terms of how do you support menstrual health, even for Saral or for our entrepreneurs, one question that would, come a lot in what is the evidence that menstrual health actually impacts girls going to school. People feel that, but is there a study which has been done? So over the last 5 years, a lot of research has gone into it, and now we have actually documented proof on how menstrual health is actually an intersectional issue. It intersects with WASH, sexual reproductive health, education. There's so many factors that get influenced because of menstrual health, and that's what makes investment in menstrual health super important. So moving from, I think, what you said in terms of what you look at in an individual non-profit organization to be successful before you make them a part of the PAD project. I think Ajita, recently, I think a couple of days ago, you have written a exclusive article on menstrual health, right? So I just wanted to hear what were your insights from there from a business aspect. So we know a lot from what will make a non-profit successful getting into the space, but there is some coverage that you did over there. So very excited to hear about it.
So my one takeaway from that story, which I did recently, was as to how the traditional ways of distributing these feminine hygiene products through a traditional kirana store. We have like 15 million kirana stores in the country. These are Melissa, kirana stores are neighborhood grocery stores, which are pretty much the lifeline of India. But selling sanitary products through those chains are not really viable. Most of the entrepreneurs I spoke to said it's not really viable because of the stigma that is attached to it. So, a woman the man across the counter is more embarrassed when a woman goes and asks for a sanitary napkin, and he would quickly, hurriedly pack it in a opaque black cover and give it to her and try to get rid of her so that nobody comes to know what she's bought. So that is the level of stigma and embarrassment attached around it. So the most of the entrepreneurs I spoke to told me that most of the premium PAD project owners, they told me they prefer to be digital only because they're able to generate far more conversations around the topic if they're digital only. And women are wanting to speak. Women have become extremely open, to talking about period. Even in my case, if at office earlier, if I would talk, raise the subject, people would not even give me eye contact. But now, even people are talking about it. They are open to talk about it. So that is exactly what the new age entrepreneurs told me, that they would prefer being on a digital platform, because women are wanting to talk about a lot of issues around menstrual health. So typically, if they want to say the issues that you typically get, like you get cramps, you get acne, and people are, women are more and more talking about it, and on a digital format. They don't want to talk, they don't want to go to a store and really buy the products, but it is kind of, as long as it's digital, so a lot of, they're able to create products which a woman would need during at that point of time. A lot of innovations are happening, and some of the low cost sanitary napkin brands like Saral or a She Wings, they also, though they really they're catering to their target audience are lower income communities. They also are not comfortable selling their products through the traditional outlets, because again, the challenges they told me is affordability and availability. So again, a woman who lives in a village will not want to go, will not want to travel to a kirana store to buy the product. So a lot of them are, resorting, like Suhani mentioned about her project, about her Sangini project, wherein women go and deliver to the doorstep. I spoke to a whole lot of other companies who kind of are partnering with corporates, the CSR arms of corporates. They're partnering with government institutions. They have awareness campaigns, and through them, they distribute free to the communities. So there are a lot of business models which are evolving, but I'm really surprised to know that people are still finding the traditional route which bulk of India does business through. They're not finding it very viable, though there are some brands who are doing it. But I think for that you need huge amounts of capital. And the other thing which came out was new age men's brands, be it male grooming product. Those kind of businesses have evoked interest in the minds of corporates. One is seeing a lot of mergers and acquisitions happening in that space. Like Marico, for instance, acquired Beardo, which is a male grooming brand, and Reckitt has picked up stake in the Bombay Shaving Company. So the question I asked to most of them, why is it that corporate India is not showing as much interest in kind of investing in a female hygiene brand? So a lot of them told me that we are getting there. It's going to take a while, because most of these brands as of now are very small. So they need to build some bit of scale in order to attract investment. But the day is not too far. I mean, already people are much more open about talking about period and female hygiene. That is what I gathered from the reporting that I did. I may be wrong. I'm not sure, but I'm just telling you my understanding of this.
No, I think it's very interesting, because it's a century-old problem. To solve this, I think we all have to be very, very innovative in how we take it forward. So there is a premium segment which is digital only, and the more informal distribution networks also have to be very creative. Also, I think the thing that you mentioned about traditional retail or modern retail, there's a lot of credit period and funds that have to be available. So I think we're covering a bit of it in the last session in terms of innovative financing, invoice financing also, which could help people who want to go into modern retail form of distribution also. So I think there's a lot that needs to be done, and there's a scope of creativity and amazing future going forward. So even especially in India, I think since 2005, the market of menstrual hygiene has actually doubled every 5 years. So a lot of people have gotten and done their bit. So we are excited about the future, how it goes forward. And moving from like writing articles about menstrual health from a business perspective, Melissa, would you tell us a little bit about the book that has recently come out? The background is really interesting.
This is a book. It's called Period End of Sentence, a new chapter in the fight for menstrual justice. It was written by Anita Diamond, who wrote a book called The Red Tent, which first kind of took on that subject. It's just been announced in honor of Women's Day, International Women's Day, Women's History Month in the US, but you can pre-order it on Amazon, and then it's coming out it'll be available on Menstrual Hygiene Day, which is International Menstrual Hygiene Day, which is May 28th. So this tells stories around the world and this movement that we are all a part of for menstrual equity and for women recognizing that they don't need to hide this issue.
That's fantastic. I think from people are learning a lot from this webinar already. I'm sure these stories and going through the stories in detail would inspire them further. So I think I'm coming to the last question of this panel, which is from us, and this is more of a personal journey. There's a lot to learn technically from each other, but we know that anything to do in the social space is fairly challenging. So what inspires you to continue to work in this space? So Melissa, you may start first, and then Ajita, you can share what makes you work in this space.
I love all the people I meet, like both of you who I'm participating in the panel with today, and just connecting with women now from all over the world. The students that I work with who are brave and young and ready to be on the edge of getting this equity happening for all of us keep me inspired. And really, I just want for periods to be seen as the source of strength that I think they are, and not as a source of shame. And so I'm inspired by the messages that resonate that I get from all over the world. So it's humbling and exciting work.
So I find the social sector full of surprises, and that really inspires me. So I've been a corporate journalist for almost, I think, close to 25 years now. And typically, you know what to expect if you're doing a story around the corporate sector. It's really not too many surprises. You really know what to expect. But each time I go to rural India, I go to tier 2, tier 3 markets, I just learn a lot, and it's full of surprises. I was in Bhuj 2 years ago, we did a craft tour, me with a couple of friends, we did a craft tour, and we wanted to have some local cuisine there. So then we were taken to this lady who kind of who serves excellent meals, the traditional Bhuj, the Kachi cuisine, and she cooks it herself. She lost her husband in an accident, and she had 2 girls to raise, and very, very, very conservative family. They would not allow her to step out of her home, so she had no choice but to start her own home kitchen over there. And you go to I think her kitchen is in a place called Bhujodi. So in a village called Bhujodi. So if you want to have local cuisine, you can go there. She'll charge you 100 or 150 rupees, and she makes the most authentic Kachi cuisine that you can ever expect. So her zest for life, her willpower is something which really, really kind of left an lasting impression in my mind. They have to keep parda, so they cover their face, and they're not allowed to step out. And but she makes a living by cooking food for the tourists who come. Actually, she's not very well known now. She had just about started when we went there. But I thought she was kind of really, really, really a brave woman. And there are a lot of entrepreneurial stories which are coming out of small town India, and one should really capitalize on them, and because that is the market. People are aspirational there. They want to use products. They're aware of products. So again, in a village near Latur, we met this woman, lady who kind of who showed me a sachet of Pantene. Okay, so I asked her, what's your hair wash regime? So she said that on a regular day, she would use anything which was available. But that particular day, she was going for a wedding, and she had to look her best. So she got to know that Pantene will make her hair look silky. So she, bought that. She had that sachet, and she was planning to wash her hair with that. So the point I'm trying to drive is the aspiration levels of people in small town India are really high, and and I'm sure most of the corporates, most of the startups are doing their best to reach out to that market. But that is the market, I think, which the next growth story will definitely come from there.
I completely agree. I think if and when the 5 trillion economy of India is going to come from the Bharat story. And there's aspiration, there's inspiration, there's so much to learn,
Yes.
and every time.
I'm so excited about the Bharat story.
Absolutely.
So much to learn.
So we do have amazing people who have joined us from various different parts of the country, as well as we see a few from South Africa as well. So now the floor is open for questions. So please keep posting your questions in the chat. Meanwhile, I'll just set something up. Let's see. Please start posting your questions us and make them, if there are specific questions to Melissa or Ajita, please mention them as well.
Yes. I am Bhanumati from Andhra Pradesh, Kakinada. I am also working for an NGO, that is All India Women's Conference. All India Women's Conference based in Delhi, and ours is 33 years old organization in Kakinada. Delhi is a 93-year-old organization. But here we have started making sanitary napkins at low cost level. As you said, people, I met recently a few the girls. They are from small in what area in Kakinada. They said they are having only one kirana shop where the boys sell the sanitary napkins. When they go for purchase them, he will ask, because there are two sizes, big one, small one. Which is your size? That's the question he asked. What is your size? Then they said they will run away. Instead of purchasing, they feel that what is the question, odd question, madam? How can you answer? Then I told them, because we are making napkins, we are giving it a low price. You take from me, from our organization, you start selling. Instead of going to that boy's shop, then he will come to you begging, please give me some business, madam, like that. You please do that way. Then they have started now, madam. That's what I want to share with you. They are very, very happy with that process. And now they're insisting of me coming to that shop and telling them, hey boys, you go away, you close your shop, we are running our own, like that. They are so confident, they became so confident. That's what I want to share with you. My name is it is my granddaughter's name. My name is Bhanumati, not Sai Anjali. That what the webinar in her name. So the Gmail. So I am Bhanumati. Next, another thing I put it in the chat box. What about that Saral designs? Either shall we have in our place also that model? How much it costs? That's what I want to know.
Firstly, thank you so much, Bhanumati ji, for joining the call and sharing the story. It's very inspiring to hear how you're changing the barriers. We have one segment where we go into breakout rooms and go into specifics of which machine will suit your location. So we have a lot of people from Saral Designs who have also joined for taking these specific questions. So we'll request you to wait till 12 for that. But a lot of these smaller questions are getting covered. In fact, in our next session, Karthik, who is the CTO of Saral, is also going to take questions on the new trends and which machine can you choose for your own space. So we'll come to that soon. Thank you so much. I think there are a few questions which are coming in terms of investment, where do you start from, etc., which we'll take in the next discussion, which is very specific to feminine hygiene as an industry. But please keep putting your questions. We'll address them in some or the other part of the webinar for sure. Super. So what we will do is Ajita and Melissa, you can share if there are any good ways to get in touch with you, either on LinkedIn or some other way. If people want to get in touch with you for future questions and collaborative projects, can you share what is the best way to get in touch with you?
I'm sorry too. I am also on LinkedIn, and I'm going to go ahead and I'll put in the chat. Those are two different ways you can get in touch with me. And I would love to hear your stories. And thank you so much, Ajita and Suhani. I loved being with you here today.
Ajita, thank you so much, Ajita and Melissa, firstly, for joining us. We couldn't have started the session on a better note. It's full of inspiring stories, engaging conversations. So thank you so much. It's quite late in the night for Melissa, so I'll not hold you back, but you can continue to be on the conversation and listen to everything else that we have in store. But thank you from the entire Saral Designs team, and I'm sharing on behalf of the other 49 participants also. Thank you for joining.
Thank you. I love
it. Was absolute pleasure. Thank you so much for having me over. Thank you. And I learned a lot.
Me too.
All right, everyone. So we are moving to our next session, which is with Karthik Mehta, who will be starting soon. If you have any specific questions, you can post in the chat box till we set this.